give an update on the latest information around coronavirus or COVID-19 in the county and on preparations the county has made to address the likely spread of the virus. Franklin County is committed to our mission of providing services which are responsive to the health, safety, and general welfare needs of Franklin County residents, especially during times of public health uncertainty, as is the case with COVID-19. The board wants to reassure residents that we, along with our state and local emergency service and healthcare partners, remain prepared. In light of the escalation of cases across the state, it won't be a surprise for us to get our first case. We are ready to address what needs to be done to safeguard our residents. So to that point, we'd like to welcome this morning several special guests. We thank them for making time in their schedules on short notice. Dr. TIRUPATHI is the Infectious Disease Medical Director at Keystone Health. Doctor, good morning. SHERRI STAHL, Senior VP at WELLSPAN Health. SHERRI, thanks for being with us. Jake CRIDER, Director of Emergency Services, Franklin County. Jake, good morning.
Good morning.
Mark Singer, Court Administrator for the 39th Judicial District. Pastor Scott Bowerman, and we thank you, Reverend, again for your prayer this morning from Central Presbyterian Church in downtown Chambersburg. Jason Staines is with us this morning, Waynesboro's Borough Manager. Jason, good morning. Warden Bill Bechtel, Warden of the Franklin County Jail, and Tracy Klein, Director of Franklin County's Area Agency on Aging. To start things off, we'd like to invite Dr. TIRUPATHI from Keystone Health up to the microphone to our right. Doctor, good morning.
Good morning.
Thank you for being with us.
As you guys all know, this is a very rapidly evolving situation, not only in this county, but also across the country. As Pennsylvania braces for more cases, preparation at the local, state, and federal level is ramping up. For us, the safety of our patients and staff is paramount, and we're doing everything humanly possible to prevent transmission of infection on our facilities to patients or to other patients or to our staff. We are, as we speak, we're exploring different options and innovative options of testing our patients for this infection. And I would say you could never be completely prepared for something like this, but you can do the best and try to flatten the curve, and that's the goal.
Thank you, Doctor. Any questions from the board?
Yes, Doctor. What sort of testing capability have you managed to acquire?
So as of now, we have two pathways for testing. One is through the Department of Health, and the turnaround time is anywhere between 24 to 48 hours. The other pathway that we are using is through commercial labs, and we have an agreement with LabCorp, which is one of the national labs, and Quest, which is another national lab. And testing has been initiated in our facilities, and we are looking at how we can scale up our operations in terms of providing more testing.
Thank you, Doctor.
Thank you.
Appreciate it. SHERRI STAHL's here to discuss WELLSPAN's efforts. SHERRI, good morning.
Good morning, everyone, and thank you for the invite. I guess I can say it's a pleasure to be here. I'm not sure that under these circumstances that's the right statement, but just wanted to note we appreciate your support and continued leadership through this, and we have a strong group of physicians, clinicians, and leaders at WELLSPAN who are working diligently to continue with our mission of, first of all, being here as your local health system and being able to deliver quality and safe care to our patients. Yes, what you've probably seen in the community and heard about is our tents. We do have 3 tents right now through our community, one at Waynesboro Hospital, one at Chambersburg Hospital, and one behind building number 2 at the Summit campus. And that is really to address the testing issues and some of the screening that's needed for our community. There's concern about number of hospital beds. We're doing everything that we can to ensure that we have open and appropriate hospital beds to address our community need when and if it arises. And some of that means looking and being proactive with some of our scheduling of elective procedures, surgeries, things like that. This is fast and fluid as far as decision making. So one of the other things that we're trying to be very proactive on is just the care of our staff. It's very important, as Dr. TIRUPATHI knows. both at Keystone and within WELLSPAN, trying to protect those healthcare professionals so that they are ready and able to provide that care. We have a lot of respect for Dr. TIRUPATHI. We are consulting with him on a regular basis, and it's really a good example how we work across the healthcare system to assure that we're taking great care of our community, because that's why we're all here. Thank you.
Okay, next I'll turn it over to Jake CRIDER, who's Director of Franklin County Emergency Services, to talk about ongoing efforts in emergency services. Jake, good morning.
Thank you. Good morning. First of all, I just wanted to thank the commissioners and county administration for all the support that they give BES not only during this time, but throughout the year, so I appreciate that. I wanted to start off by saying that we've been actively involved with this for several weeks now. It started right in the beginning of March. We were contacted by PEMA, who is the agency that oversees all emergency management in Pennsylvania. And we started getting information then. More and more of this has been in the news for probably a month or so. So on March 6th, we activated our EOC, which is the Emergency Operations Center. There are 3 levels, 1, 2, and 3. The level we're at right now is a level 1, which is the lowest level. We have been working tirelessly with the local members of the community, different municipalities. We've been talking with all of the local EMCs. Each municipality has a local emergency management coordinator. We've reached out to them with information. We've had meetings, and we deal with the Department of Health on a daily basis. We get most of our information from them, as well as PEMA. They give us the most up-to-date information and recommendations. So it's basically, ever evolving, things keep on changing, and we have a great group of people out there for right now.
Good morning, commissioners and guests. Just wanted to give you a brief update. We have been working very closely with our local EMCs, as Jake alluded to, and we did have the conference call with the county yesterday. The county has been wonderful with disseminating information to the municipalities, and we do have an action plan in place to keep essential operations of the borough running. We do have plans for water and sewer coverage, maintenance as well. Police and fire protection will continue. We also had a meeting yesterday with our emergency services providers in Waynesboro, and we do have plans in place. While they may operate a little differently with some screenings at the door before going into a home in some situations, in other more serious situations, they will continue business as usual.
Good morning, commissioners, guests. Franklin County is taking every precaution to prioritize community and workforce health and well-being. Currently, Franklin County senior centers are closed until further notice. Franklin County jail visitation is restricted. Non-essential events will be postponed or canceled, and we are encouraging social distancing for essential gatherings. We have also adjusted workforce policies to restrict non-essential travel and to make it easier for employees who don't feel well to stay home. We are working toward remote work for staff. Because this is an evolving situation, the county will revise these plans as appropriate. Franklin County is committed to providing resources to residents and essential services that ensure the health and safety of all. Thank you.
Thanks, Carrie. I just want to thank our special guests again this morning for being with us. There's a very high level of confidence that the community is in good hands, and there's a lot of planning that's gone on. I feel good that everyone's prepared. There's a lot of cooperation, and there's certainly a lot of communication going on. I'll just wrap it up by saying public and workforce safety is our #1 priority. Franklin County takes great care to assist our partners in maintaining public health, but it's up to each and every one of us to help mitigate the likely spread of coronavirus in our county in order to maintain our public health to the fullest extent. During this unprecedented time, we want to remember, while many will be hunkering down at home, our nurses, physicians, and healthcare workers are on the front lines, prepared and ready to help. We thank them sincerely by doing our part to lessen the impact of coronavirus on the community. So please, once again, practice social distancing, stay home if you're sick, And the best defense for coronavirus is wash your hands. Not only do these practices help to keep us safe, but they work hard to avoid overloading our healthcare facilities. As I said, this is an unprecedented and evolving situation. We must be patient with others and also with ourselves, remembering that everyone reacts differently to stressful circumstances. We encourage all Franklin County residents to review tips on coping with stress found on the COVID-19 fact page of the county's website at www.franklincountypa.gov. We are in this together, and we will overcome this together.